Thank you. This is the last session of the public hearing. Let me remind deputations and individuals attending this meeting. You will find in front of you a microphone and an earpiece. Channel 0 is the floor, 1 is Cantonese, 2 is English, 3 is Putonghua. Let me also remind you that no matter what you say orally and what you state in your submissions is not protected under the Legal Powers and Privileges Ordinance. If you would like to refer to the points to note to members of the public attending public hearings or sitting in the public gallery, you may refer to the copy in front of you. If you have any questions, please contact our security staff. Let's start the public hearing. Each deputation and submission will have 3 minutes. You'll need to stop when your time is up. We start with number 74, Mr. Chen Jianjiu. Good afternoon, everyone. My name is Chen. I am a doctor in the public health faculty of the Hong Kong University. Well, I have been doing some research and I would like to give you some useful information. What I'd like to say, first of all, is in relation to some scientific research are done by funding from tobacco companies. I think the public should be aware that the funding has a huge impact on the results of the research. Back in 1953, in America, tobacco companies have set up a tobacco industry research committee. They have made use of a lot of different ways to reject the correlation between various illnesses and tobacco. At that time, tobacco companies try to make use of funding support to influence the result of studies. It is now properly evidenced. There are many other examples. Back at the end of 2011, in Australia, there was a policy for plain packaging of cigarettes. Tobacco companies were not happy. They have conducted 2 assessments and they arrived at very similar conclusions. They thought that plain packaging of cigarettes will not have an impact. In other words, it won't bring any benefit to public health, but there are some independent researchers saying that it has made the difference. Of course, it is impossible for me to set out in detail how different they are. But there are many different ways for tobacco companies to distort research conclusions. When we see research evidence that is skewed by tobacco companies, I'm sure that you will fully understand whether to believe these conclusions or not. Thank you. Next is number 76, Ms. Yan Choi Kei. Hello. You may sit down. Well, our boss was very good to us. In the past 3-4 years, the turnover was poor, and I could feel how my boss was working very hard. In the past few months, our bosses have told us that business is hard. A lot of smokers have turned to heat not burn cigarettes in the underground market. We have asked a lot of our regulars who have turned to heat not burn cigarettes if they would switch back to conventional cigarettes after the ban. They said no, they would continue to use the black market. And I told them that is illegal, and they said that it's very easy to use heat not burn cigarettes. It's not, the smell is not as strong. And oppositions have come up with some other authoritative reports saying that heat not burn cigarette is not as harmful as conventional cigarettes. Well, each heat not burn cigarettes will cost easily but $1,000. How can students afford that? If the administration has legislated to ban heat not burned cigarettes in the first place, then there would not be a bloom of e-cigarettes in the market. Now you don't allow small companies to sell these e-cigarettes. You're trying to stifle our room for survival. A lot of us will lose our job. We live under pressure. Smokers are forced to break the law. I hope that the government will reconsider the many different proposals. Thank you. Next is 77, Ms. Leung Mei Kam. Good afternoon, Chairman. I've been working in Kwun Tong for over a decade. A lot of the residents will come to buy drinks and magazines from our shop. I've been working there for over a decade, so I know them very well. Sometimes they would bring with them the children. They would leave their children with me when they go to shop, so that we wouldn't mind the children for them for a very short time. Some regulars would come to talk to us. Some of them asked if we sell heat not burn cigarettes, and I asked them why. They said that heat not burn cigarettes doesn't emit a strong smell, and there is no ash, so it won't affect their family members. My husband has been a smoker for many years. He simply cannot quit. If there is heat not burn cigarette, I would like him to try. Then I won't have to be subject to secondhand smoke, and there won't be ash everywhere at home. The government wants to ban heat not burn cigarettes. I think that a complete ban seems to be too rash. They have taken away the right to choose amongst smokers. I hope the government will give full consideration to the demand for heat not burn cigarettes, because those who smoke heat not burn cigarettes will have to be forced to smoke conventional cigarettes because they have no choice. I ask the government to be considerate. These are law-abiding citizens. There should not be a complete ban. They should be given a choice. It's better. Thank you. Thank you. Next is 78, Ms. Sito Chun Yin. Good afternoon, Chairman. I am a newspaper agent in Cheung Kwan O. Well, we have been trying to cut costs and increase our revenue. We make money from drinks and cigarettes. Business has been shrinking and rent has been put up. The government has been combating illicit cigarettes, but still they are quite rampant and it eats into our business. The government said that number of smokers has dropped, but that is not the case. There are still a lot of smokers. The customers have turned towards illicit cigarettes. Some of my regulars have also switched to heat not burn cigarettes. They think that they don't reek of smoke and they don't want to change back to conventional cigarettes. So the ban on heat-not-burn cigarettes will give another boost to illicit cigarettes. The government said that they don't want youngsters to start smoking heat-not-burn cigarettes. We don't agree. Newspaper agents are always very law-abiding. We don't sell cigarettes to students. If you don't want the illicit cigarette market to expand, then they should step up law enforcement, and then the problem will go away. We ask the government to take back the across the board ban. We all want Hong Kong to be good. We all part of Hong Kong. There should be public consultation so that there will be participation from the public. We hope that the government will protect us. Please do not lend a hand to illicit cigarettes. Thank you. Number 79, Ms. Kong Yuk Chen. My name is Kong. I work in a newspaper agent in Lam Tin. We do business with regulars and Kai Fongs, but I find that business has shrunk. I found that less people buy cigarettes, and I asked my regulars why. They said that they have turned to heat-not-burn cigarette. I said, is it better? They said, well, it doesn't have a strong smell. And my children complain about the strong smell. That's why I have made a switch. I said, you're doing something illegal. They said, it doesn't matter. It's better than reeking of smoke. And I said, you won't buy conventional cigarettes? They said, no, I'd rather do something illegal. Well, our business keeps dropping. And I also learned from the television that the government said that heat-not-burn cigarette will become illegal. I'm sorry, I've forgotten what I want to say. I am aware that the government proposes a complete ban. Why don't they legalize it? Then people can buy freely, and we will be able to continue with our business.
I hope that this view will be taken into consideration, and that you would legalize the HNB. Mr. Yun Hong Kin, number 80. Our company has been working in manufacturing over 20 years in Hong Kong, and we have undertaken design, printing, and installation of different products. Because of the nature of our job, myself and our staff have meetings with our clients. We have turned to HNBs, and the clients would tell us that you have been cleaner, you have a better presentation, personal presentation, and I think this has been positive for our image. And in the last few days, we have heard that the administration would have a total ban on HNB and the e-cigarettes. So I'd like to say to the LegCo, it is better to regulate rather than a total ban. That will help us to create a better impression for our staff, and that will also give our staff the right to choose in what they would like to consume. Mrs. Yun Yok Kun. She's not here. 82. Mr. Lam Ho Fung. Mr. Chairman, I am a non-smoker, but I have friends and people around me who smoke. And ever since the heat-not-burn cigarettes appear, they are turning from conventional cigarettes to HNB products. And for a non-smoker like myself, I feel that the risks for HNB is lower. There are 3 points. They are smokeless, odorless, and ashless. And for all non-smokers, and the impact is lower, and that it is not so smelly for non-smokers. The government can regulate but should not go for a total ban. The next one. Number 83, Mr. Lam Pui Wah. Mr. Chairman, the heat-not-burn cigarettes have less odor than the conventional cigarettes. For smokers, in order to reduce the smell, they have turned to H&B, in particular for those who are in the service sector where they are in contact with clients. For the smokers, H&B would allow them to reduce the impact on the other people and also create a better image of themselves. In developed countries, for instance, Japan and Korea, they are selling heat-not-burn cigarettes. And I don't understand why Hong Kong should keep away from that. I hope that the government will have legislation to regulate these products and do not go for a total ban. Number 84, Mr. Leung Yu Hong. Mr. Chairman, and I would like to, on behalf of the Deutschland car company, we believe that the regulation is the better way. And for the we are providing renting of high class cars, and in the past we banned smoking for our drivers, but we cannot ban smoking in the cars because burning cigarettes would leave the driver a smell on their clothes and also on the upholstery. So there would be complaints. So I think that e-cigarettes and H&Bs are very good alternatives because they would allow a balance to be struck between the drivers and the clients. And it is the same thing with rented cars. But if there is a smoker rents the car, it will still leave the odor of cigarettes in the car. And the people that rent our cars would not really follow the ban of smoking in the cars, because we need to have a lot of resources and time to take away the odor of stale smoke. So we respect the choice with regulation. And in many countries, they are not banning the e-cigarettes in the rented cars. Now, if we for the H&B and for the e-cigarettes, for the driver or the clients, if they use such a products, it would allow us to raise the image of our car renting and also be positive for the sector. So we would like you to consider regulation instead of a complete prohibition. Mr. Leon Pongtingbong, my friends around me are switching from conventional cigarettes to e-cigarettes. However, since it is not under regulation, it is not legal in Hong Kong, they are going for illicit sources. And for many of us, we cannot switch back to conventional cigarettes once we are on to the H&B or the e-cigarettes. And all these products have lesser negative impact on the people around us. If you ban this ASP, you are forcing them to go for illicit ASPs. So we hope that you will legislate to regulate instead of a total ban. Mr. Leung Yat Ming, number 86. The administration is considering on the total ban of ASP. One of the stated purpose is to prevent the adolescents from access to the ASP. For the non-adults, they would go through illicit channels to acquire such products. If you want to limit their access, you should go for regulations instead. Number 87, Mr. Sing Yuk Ying. I have several stands, newspaper stands. Since there are free newspapers distributed and online newspaper, there are very few people buying periodicals or newspapers, and it has become very difficult for our operation. I'm still hanging on, and the cigarettes and the drinks that we are now selling have become the main source of our income. However, recently, many of our clients have gone to contraband e-cigarettes instead of buying conventional cigarettes. If you're going to have a total ban across the board for the ASP, you are really encouraging illicit trade, and you're hitting hard against our trade. So we are to protect our staff and their livelihood, and so we hope that you would draw back the total ban, and that you will follow the regulation of the conventional cigarettes that would be applied to ASP, so that they can go to legal channels to buy ASP, and in this difficult situation, you can help us to stay on and to be able to make a livelihood. Mr. Li Chunyan, I'm a non-smoker. I have friends and colleagues around me who are smokers, and I have suffered under passive smoking for a long time, and some of them have switched to ASP. I discover that there's much less smell from the HNBs and e-cigarettes. If you have a total ban of this ASP, they will go back to conventional cigarettes, and that will indirectly impact on non-smokers who have to suffer the damages of passive smoking. So you should have a public consultation to listen to the public's views on the ASP, and that you will reconsider regulation instead of a complete ban. Mr. Shi Park Ho, number 89. Mr. Chairman, I'd like to thank you for this platform to allow us, the various companies and the individuals, to speak here. I speak on behalf of the Ever Fortune Tobacco Limited. Well, for the total ban across the board, I have one point to say. ASPs are not dangerous products. They are not poisonous products. Why is it that we cannot be regulated like the conventional cigarettes? You say that for your own good we are banning these ASP. Why don't you ban electronic games or the alcohol or horse racing? So we are helping the import of ASP, and sometimes and very often we transship them to other markets abroad. for instance, the Southeast Asia. Well, the imported ASP, we are warehousing it before we transship it. Why is it that you are banning storage? So very often we need to import them and transship them. If these products are not to stay temporary in Hong Kong, then the transshipment business in Hong Kong will suffer. Well, you are banning the import and re-export. So you are really taking away the non-tax export of such products. Well, that has not much to do with the adolescents here. So we need to have an appropriate policy, and we should not have a policy that cut across the board. Hong Kong should be a free port and should have to continue its free trade. That goods and finance can enjoy a freely flow. Well, I'm afraid that being negative on these undertakings have nothing to do with the adolescents' health. So I'd like to have a withdrawal of such a proposal, and that you should adopt an objective consideration of this proposal to allow us to survive. Mr. Madigon, our design company is engaging in advertising designs. We are serving the mainland clients and Hong Kong clients as well as international clients. Hong Kong has always been attracting talents and companies to headquarter in Hong Kong because we have a complete legislative process as well as freedom in import and export. Now we are seeing a total ban on HNBs. According to what we have understood, heat-not-burn cigarettes belongs to category of new products, and it has much lower risks than conventional cigarettes on the people's health. Hong Kong government is saying that technological innovations can help us, but you are banning HNBs, which runs counter to your stated policy of technological innovation. HNB are to be banned, when they are much less damaging than conventional cigarettes. This will have a negative impact on the freedom of commerce and trade in Hong Kong. So we have to take into account the negative image on the trade.
Number 91, Mr. Lam Yuk-man. I am a transportation worker. I have the habit of smoking. Well, lots of my fellow workmates smoke. Well, whether you're a smoker or not, there will be the problem of secondhand smoke. I may not understand very well about heat-not-burn cigarettes and conventional cigarettes. I think, anyway, that heat-not-burn cigarette may benefit one's health. I think that it is better to use electronic cigarettes. if there is a complete ban, well, I don't know if it is a good thing. The government should listen to the public. Is it the case that the government is doing something behind closed doors? So that's all I want to say. Thank you. Number 92, Mr. Chu Hang Feng. Thank you. Well, the permanent secretary of the deputy secretary of Amy Yuen is here. I hope that she will listen to me. When I owned a shop that sells heat-not-burn cigarettes, and I can tell you from first-hand experience that my brother has started smoking electronic cigarettes. His health has improved. I do retail of heat-not-burn cigarettes. All my customers, all of them, said that their health has improved after they have turned to heat-not-burn cigarettes. Well, I'm not. I wouldn't say that it is superb, but they said that electronic cigarettes is much better than conventional cigarettes, and my staff members said that they feel very good about doing this business because they feel that they can help people. Police officers, doctors, nurses, they smoke heat-not-burn cigarettes. Previously, there was a police officer who was arrested because of heat-not-burn cigarettes because it's illegal. Well, it's a police officer, yet he has chosen to use heat-not-burn cigarettes. Well, now, and there are also nurses and doctors. They are healthcare workers, and they use heat-not-burn cigarettes. Where is the evidence saying that heat-not-burn cigarettes is worse than conventional cigarettes? Please bear in mind that heat-not-burn cigarettes and electronic cigarettes are completely different. Well, the Japanese government supports heat-not-burn cigarettes. In taxis and restaurants and bus stops, you can smoke heat-not-burn cigarette, but not conventional cigarettes. That's the Japanese government. Well, do you think that they don't have experts to look into this? Well, it's been a number of years since heat-not-burn cigarettes were launched into the market. Well, it's found that there is only one country that legislates against heat-not-burn cigarettes. That is Singapore. That even is the government that banned rubber gums. So there are a number of countries that banned e-cigarettes. So please bear in mind that these two things are completely different. I will now jump to 105. Miss Meng Yun Kam. Well, I've been smoking for about a decade or so. Well, my friends and including my husband cannot manage to quit. They are not like me. Well, I have been a smoker, so I know how strong the smell is. My husband is still smoking, so I know I can still smell the strong smell. I know that there is something called e-cigarettes. Some of my friends use it. I do think that the smell is not as strong and it affects less people, fewer people. Isn't it better to regulate it than ban it? People who would like to quit can try it so that they can cut down on the use of cigarettes towards complete abstention. Now I go back to Mr. 97, Professor Kevin Choi. Hello everyone, I am a professor in economics and I would like to explain to you why a complete ban of heat-not-burn cigarettes, e-cigarettes and alternative tobacco products will harm public health and it is illogical. The spokesman of the FHB said that these alternative tobacco products may be very fashionable. Well, they have used advertising that targets youngsters to try to get them to use these alternative smoking products. And they said that there is no scientific evidence showing that these products will help people quit smoking, and also there is information showing that the harm of these products is underestimated. There is a UK journal which says that e-cigarettes is better than nicotine replacement treatment. It is 200% more effective. Smokers said that they have cut down on conventional cigarettes. So for people who are trying to quit, is indeed a replacement of conventional cigarettes. And there's in relation to the saying that people who start electronic cigarettes will eventually turn to conventional cigarettes. Well, there is another research. How does electronic cigarette access affect adolescents smoking? It says that, they said that when it comes to states that ban the sale of e-cigarettes, the number of youngsters that have started smoking conventional cigarettes has risen by 0.9%. Well, and they also said that the public has underestimated the harm of alternative smoking products, and that is not grounded at all. So I oppose to this bill because it has misled the public. More youngsters and smokers may turn to conventional cigarettes. I would like to ask Dr. Chen, the secretary, how come that so many overseas governments support heat-not-burn cigarettes over conventional cigarettes? Number 99, Miss Elizabeth Zhang. Hello everyone. I engage in studies about drugs and smoking. I support a complete ban. While a number of journals and literatures, local and overseas ones, said that, well, if people smoke e-cigarettes, there is a higher chance that they will turn to conventional cigarettes. There was a study done saying that 73% of P4 to P6 students have used e-cigarettes before they turn to roll-up cigarettes and conventional cigarettes. According to a journal in the US dated 2018, about 20,000 students were interviewed and they were under the age of 12. A third of them and a quarter of them said that they have used electronic devices to smoke cannabis or THC, because these are made to look fashionable and classy. Well, I do think that we need to learn from that. There is an abundance of literature saying that, well, smoking can blur the line with regard to using drugs. And well, for students who have used drugs before, there is a 47% of them have used have smoked before. But although it doesn't say that, well, smoking means smoking conventional cigarettes or e-cigarettes, if you conduct further study, you will know that there is a high correlation between smoking cigarettes and taking drugs. In terms of legislation, I think that there should be a complete ban of e-cigarettes to nip it in the bud. Regarding health education, organizations can use smoking and e-cigarettes into a separate subject so that sensitivity can be enhanced. In relation to research and study, I hope that there can be more in-depth studies conducted to provide a more comprehensive report and analysis so that the public will know about the hazards posed by cigarettes. And the e-cigarettes should be a separate study subject. Thank you. Ms. Pao, number 100. We have been promoting health education as well as not using drugs. We think that e-cigarettes has invaded into campuses. We've been asked to provide talks. A lot of social workers said that some students have used e-cigarettes, some primary school students have used e-cigarettes. Well, some parents said that they thought they're toys and that's why they bought them for their children. It shows that there is lack of publicity and education. There should be a complete ban.
Hi. Well, the adolescents are rather easy for them to assess such products. Some of them are rather diversified, claiming that they have vitamins, they are natural, they are harmless, and so they attract the first users. And we also discover that many adolescents are really not very vigilant vis-a-vis the SAP. Some of them have seen videos on social media which leads them to believe that it is fashionable. They are very curious. They'd like to try. So, and also researchers have shown that there is interaction between the individual and the society, and there will be a renormalization of smoking through this ASP. And according to the statistics, 23% of smokers have gone to the ASP. So there is a correlation between the ASP and the conventional cigarettes. So we support the total ban of ASP. So we should really tackle the root cause for smoking. We should increase resources for the prevention of smoking within the among the adolescents. So, firstly, we will appeal to the schools and the parents to educate at an early stage the harms of the ASP. Parents should stop smoking themselves and seek assistance if they do. Mr. Park Wing-lok, I do not think that there is a total ban across the board. There are many people around me smoking H&B cigarettes. If you have a ban, then it will go underground. There are for instance, marijuana and the opium smoking. You can see the queues for the methadone. So banning is not really a good approach. Forcing them to go back to conventional cigarettes. You should go by scientific evidence. If it proves that H&Bs are not as harmful as conventional cigarettes? Are we saying that we are more developed than Korea and Japan? We should respect scientific results. Applying it across the board, then it would only force them underground. Mr. Chen Mingchen, I have a convenience store in operation over more than a decade. It is very difficult for us because of the rent increases, etc. Since the appearance of HNBs, we see the falling of our sales of cigarettes. If you have a total ban, it will aggravate our case. Hong Kong is a free society. We should regulate the electronic e-cigarettes and the HNB products. Are we applying double standards here? HNB cigarettes are less harmful than the conventional cigarettes. And many of our clients are switching to HNBs. It is very easy to go for the illicit channels to buy HNBs. Even if you have a new piece of legislation, well, who will suffer from the ban? It's these small small commerce, because they can go. The smokers can go to underground channels, and then you will lose out in tax, and you will only aggravate the situation. The government is saying that we should prevent the adolescents' access to the ASPs, but it is very unfair for those of us who are selling cigarettes. We are not selling conventional cigarettes to adolescents. Mr. Ngai Siwa? Well, I would like to speak on my personal experience, and I hope you would listen to it. I have quitted smoking for 4 years. I used to smoke 7 packets a day. I use e-cigarettes to quit smoking. I am one of a living proof. And I have been smoking e-cigarettes for 6 years. I tried the quit smoking services, but it was not effective for me. I even developed a skin allergy. So such a quit smoking service center, I do not think that it is effective. However, in the span of 4 years, I use e-cigarettes to quit conventional cigarettes. I believe that the e-cigarettes can help us to quit conventional smoking. I opened an e-cigarette boutique. Well, my clients very often come back to me. We said that they have less phlegm, they are not as irritated before, they have better tastes, they have better smell, they have better vocal health. So there is no addition involved. Well, the CE, Carrie Lam, encourages to go for innovations, to go for startups. And when I opened such a e-cigarette boutique, the administration had a about face. Well, it is evident that the ASP is much less harmful than conventional cigarettes. Don't you think that Hong Kong is going backwards? As an individual, And as a boutique owner, we should amend it in such a way, prohibit sales to under 18, and we should reference the UK and the US in the ASP regulations. So ASP and tobacco and conventional cigarettes should be on a par. That should be regulated likewise. So if not, you are going for a complete ban, people will go back to conventional cigarettes, and you would drive the ASP underground, and it would be even more difficult to oversee. I am a conventional smoker. I am in the advertisement, and in fact, of course, smoking conventional cigarettes, you have a bad smell, and people will look irritatingly at you even if you smoke on the street. And many of us have turned to e-cigarettes and to HMBs. Then there will be less smell, there will be less nuisance in a meeting or on the streets. So I don't think you should have a total ban. You should have you should regulate ASPs so that you can guarantee our freedom of choice. 107 is not present. 108, Dr. Henry Yuan. I represent the Hong Kong Western Medical Union. I fully support the bill's amendment on smoking for 2019. We support it because we believe that it is a hazard to health, whether it be conventional cigarettes or other cigarettes. There are so many smokers here, and I have a lot of patients who smoke. Whether they smoke on conventional cigarettes or ASP, it is a hazard to their heart, to their lungs, or inducement of cancer. Now, the tobacco companies put out research reports that are one-sided. The WHO has ruled that the HNB cigarettes and the e-cigarettes are really hazards to health, and it should not be a substitute towards quitting smoking. I think it's a sugar-coated poison, these ASP. Some people say that it is odorless. However, that's a time bomb, an invisible bomb. And if you cannot smell it, you inhale it, and it is even worse and even more dangerous. So I would like to see this amendment bill passed quickly. Money cannot buy your health. My dad smoked 3 packets a day, and he died early because he was unable to quit. Well, if you earn money through this, you are not really being responsible for the society. Well, you say that it is driving the ASP underground. I think that more efforts should be done for the ASP if it goes underground. Mr. Brian Chu Wei Chang.
Thank you. I'm actually a smoker in Hong Kong. I've been a smoker for a number of years. Recently, I've actually just switched about 2 years ago. Switched from heat cigarettes from your traditional smoking cigarettes. One of the reasons why I did that is really due to the less smoke that it produces and the less smell that stays on my clothing. Now, this actually lowers the impact and the effects to the people around me in terms of second or even third-hand smoke. I believe the government should consider giving their citizens the options to choose, not rather than putting a full ban on. I think putting through a regulation is the best way to go. Now, I do have 2 young children. I do try to keep them away and avoid them from any smokes, but unavoidably, when you go out to Hong Kong and to the public, there are people smoking everywhere. So ultimately, they do come across that type of smoke, secondhand smoke from the people on the street. But I believe, if we do move and let people have the choice to go from heat and not burn cigarettes, that could ultimately reduce some of the smoke that we could see on the street, could help with some of the children on the street. I'm not saying smoking is a good thing, but I'm just saying that we shouldn't have a full ban on, but just regulate the process. Thank you.
The last one is Mr. Lawson, Sam Heng. Well, the administration is proposing a complete ban on the ASP. I hope that there should be a regulation and not a complete ban. Well, we have been serving the Hong Kong society. We provide advertisement as well as repairing jobs for the mainland clients and and Hong Kong. HNBs will not affect the people around you. No passive smoking, no fire hazards, and reduce the risks of fire, potentials for fire. So I think that regulation of ASP will be positive for Hong Kong. So we'd like to have the amendment withdrawn. Thank you. The administration, can you have a response? Thank you. I would like to thank the deputations present here and speak on their views. Many deputations here have spoken. They have a misunderstanding that these alternative smoking products are less damaging and are odorless. However, in the last two sessions, I tried to clarify. First of all, any tobacco products are hazardous. There is no safety level for these tobacco products. Well, claims that they are less damaging doesn't mean that they are safe or that they are good for your health.
The government has full responsibility to ensure that people can stay healthy. We have a lot of researches and studies that show that these products would emit carcinogenic and harmful substance, which is hazardous to health. And I also mentioned about it being addictive. Well, heat-not-burn cigarette contains nicotine as well. The content is more or less of the same level as conventional cigarettes. So you can become addictive and dependent on it. There are also some analysis and some studies looking into whether e-cigarettes can be a replacement. Well, there may be a reduction of consumption on conventional cigarettes still. These alternative smoking products are still harmful to health because they contain nicotine, so it is not a way to help you quit smoking. Well, there are recommendations from the WHO, and there is no evidence showing that these products can help smoking cessation. We think that the government should enhance public education so that the public will have a better understanding of these alternative tobacco products. They should become more alert and be mindful that it may be odorless, but it doesn't mean that it is not harmful. I've heard deputations and individuals who are newspaper agents saying that this ban will affect their business. They're subject to licensing, some of them used to sell newspapers only, and they would like to change the business. We will talk to the FEHD. Of course, we prefer newspaper agents not to sell cigarettes. Alternative tobacco products is still harmful to health. So we'll talk to the FEHD about the possibility of allowing them to sell other products. Some deputations and individuals talk about the black market and illicit cigarettes. Every time when we roll out a tobacco control initiative, the tobacco companies churn out the same tune. The CNE department has spared no effort to combat illicit cigarettes. They have been doing a lot of work. We can hear from the CNE, Custom and Excise Department. Well, for heat-not-burnt tobacco products, they are still subject to restrictions. Duty is imposed on them when they're imported into Hong Kong. Back in 2018, we have seized duty-not-paid cigarettes, including heat-not-burnt cigarettes, 53 million of them. 8 million of them is heat-not-burnt cigarettes, which is a huge increase. In 2017, well, we have seized about 60 million cigarettes, and only 740,000 of them are heat-not-burnt cigarettes. Well, in 2019, well, we have so far seized a large number of the 1.3 million. We will continue to combat illicit cigarettes as well as the black market. Thank you. Now, members may ask questions. We have I myself, Mr. Andrew Wen, Mr. Kenneth Leung for the first time, and queuing up for the second round. And members who are here, Dr. Pt3, and for the third round, Mr. Siu Ka-fai. I'll start. We have heard from the public over 3 sessions. There are different stances. They talk about health problems, as they talk about problems during work. Some people talk about their businesses. Some speakers are smokers, others are not. But I would like to say 2 things. It seems that no one has mentioned about why tobacco companies invented heat-not-burnt cigarettes. Did they do it to help people quit smoking? Well, because it seems from what I've heard today that no one thinks that conventional cigarette is a good thing. So is it because they want to help people quit smoking, or they want people to turn to an alternative product because these smokers don't like the smell of conventional cigarettes? I think that itself is a big problem. Mr. Siu Ka-fai and newspaper agents said that businesses have dropped, and that's basically because of illicit cigarettes, whether they are illicit conventional cigarettes or illicit heat-not-burnt cigarettes. Is it because of law enforcement agencies not doing enough. That's why there is a huge circulation of illicit products in Hong Kong. For heat-not-burn cigarettes, if they have evaded paying tax, then they can charge a lower price to attract more people to buy them. So what is the view of the CNA department? Well, whether it is a complete ban or a regulation, which is more difficult to implement, which one has a lower effectiveness? Of course, we are concerned about illicit cigarettes. We always, there's always the saying that illicit cigarette will be more rampant. Of course, the CNE department will do more. Let's hear from the CNE department. Thank you. I'll give you some figures about what we've done for 2017. We have cracked 7,900 cases. It involves about 50 million cigarettes. In 2018, about 10,000 cases. We have seized about 53 million illicit cigarettes. We see that there is a significant increase. However, there is a drop in the quantity of illicit cigarettes seized. We see that there is a drop in large-scale import of illicit cigarettes. Instead, people have broken down them into smaller quantities. And in 2018, we have enhanced inspections at our control points. We have detected about 12,000 cases, which is an increase compared to 2017. Well, the heat-not-burn cigarettes is still subject to dutiable commodities ordinance. Well, I talked about 8 million heat-not-burn cigarettes being seized. Well, a large number of them have actually been discovered because of the declaration done by the importers. Back then, actually, in 2018, 530,000 of them are discovered because the person involved chose to declare them to us. Well, I've heard different stances. It seems that there is a common ground. There should be smoking ban. I'm not a smoker. I've never been a smoker, and I don't like smokers. I am a legislator. I require policy logic to be consistent. I've heard a lot of saying that conventional cigarette is not good and e-cigarettes are not good, and e-cigarettes means heat-not-burn cigarettes or many different types of electronic cigarettes, including those you can buy from a stationery shop. Well, some people say that you start with e-cigarettes and then you will move on to conventional cigarette, but I don't understand the logic. If you think that smoking is bad, then yes, that is it. So whether we should have an across-the-board ban or we should have different levels of regulation or different level of approach. What I've heard from everyone is that conventional cigarettes is bad. But I don't really understand. At the very beginning, there were some e-cigarettes in the shape of a pen, and I saw some children using them, and I was really against it, and that was already many years ago. From information I have read, it seems that e-cigarettes contain a similar level of nicotine compared to conventional cigarettes. It's just minutely lower. So I don't really understand According to the administration, if it's so evil, then there should be complete ban of everything, including conventional cigarettes as well. How come that you have started from the middle? So I would like the Secretary to explain to me the logic. Thank you, Mr. Wen, for the question. Our overall policy is to reduce number of smokers. So we have adopted a multi-pronged approach. The discussion in the Bills Committee targets alternative smoking products. That's why we did not have a chance to expound on a multi-pronged approach to combat conventional cigarettes. Of course, we have policies to try to reduce the smoking rate. Well, there was a target set. It should be reduced from 10% to 7.8% when it comes to number of smokers. Well, you haven't told me about the logic. How do you know? She hasn't finished. I think there is a preamble. You should wait. Okay, I will. May I continue? Yes. Well, these new tobacco products have brought a lot of risks. Back in the 1980s, there was something called smokeless tobacco. We banned it. It was a new product and we could see that it was harmful. That's why we did not allow it to enter into the Hong Kong market. A lot of countries are having problems to deal with these smokeless tobacco. So it's the same logic. When we see new products that are harmful, we do something. At the same time, we come down heavily on conventional cigarettes as well. We devote resources to help people quit smoking. Where there are new products, we have to take some preventive measures. I have used all my patience, but my question is still not answered. So you think that a conventional cigarette is the all evil, that's why you want to combat it, is that right?
Well, there is a middle point product, but you are going all out for this middle product. Well, you should go for... Why is it that such a treatment between these two kinds of products? Well, that's my understanding. Perhaps that would involve the suppliers of this conventional cigarettes. I am not a smoker, and I have never contacted any HNB or e-cigarette suppliers. They have not contacted me either. You can ask for another round. Mr. Leung Kai-chung, after listening to different views, I'd like to ask one thing. I never smoke. I don't really know the products. Objectively speaking, I'd like to know, for those HNB cigarette smokers, what in fact have they inhaled into their body? What sort of chemicals are they inhaling? Are there any studies on that? Because these products have appeared in the last few years already, several years already. Dr. Fung for the Tobacco Control Office. The HNB, they launched the HMP not so long ago. As to their components, most researches have been done by the tobacco sector, but there are also independent researchers. For nicotine, which is an addictive component. Compared with conventional cigarettes, they could be a bit lower, but it would be on a par. As for the aerosols, for instance, the different components, the TSNAs, and also the other carcinogen components. As for the aerosols, when they are reporting on these components, scientists would put forward a condition. Well, the aerosols does not really represent the hazards because there's no safety level involved. So if you heat it, for instance, up to 90 degrees, well, there will be toxic substances emitted. Well, for these, the tobacco industry is doing the lion's share of researches. However, there is the independent reports to the FDA. In those statistics and data, they have said that even though they have a component tests, however, when they are listing out 90 toxic substances, including carcinogenic substances, well, the researches done by the tobacco industry have only researched on about half of the 90, about 50 substances, and they have not done much on the carcinogenic substances. So, and also that the tobacco industry, when they go for the H&B studies, we can see that we have very limited data on their components. You are claiming that there are less harmful substances in the components, which is not true. In the aerosols, the substances are higher than the conventional cigarettes, so it is rather misleading. You can raise your hands 3-4 times. Dr. Chen Puyin. I agree with the chairman. The focus of the discussion depends on your positioning. The core value, if it is for economic gains or for freedom, well, then, of course, I respect that, but that's the core value. But if your core value is health, because the public health is involved, how do we protect the public's health? How do we ensure primary health care? So we can see that there is a conflict with tobacco consumption. So in our policy decisions, are we only speak of money and gains only? Many people would say that why don't you ban conventional cigarettes as well? And this is one of the arguments. However, I would appeal to you, if you really put it forward, then I would like to appeal that you would also sign on a full ban on conventional tobacco as well, because you are putting it as an argument. Well, if you are really serious and you have in your challenge to the government, then I would like to challenge you to sign for the total ban of tobacco. And of course, I don't think that you would sign up for that. tobacco and alcohol are harmful, and it is difficult to ban it totally because in the community there are many people consuming that. But we are not talking about a new product, and we should work for the health of our future generation, and then we should step up efforts in that. For that, this morning there is a case. Well, there is a case of alcohol patient that has a crisis in the liver outbreak, and I had to treat him this morning. The tobacco industry is earning a lot of money. I can see the ravages of tobacco. I can see the ravages of alcohol. So many schools, teachers, and headmasters are supporting this amendment. So we should really put first the public health, the health of the public. The Secretary, people ask why that we should go for a complete ban rather than regulation. Dr. Chen has also put forward his views. We feel that we should ban the alternative smoking products as soon as possible. We have to protect our young. We can see that there is a gateway created by these ASPs towards smoking. We know that conventional cigarettes are harmful. That's a consensus. Perhaps the public are being misled by the claims of the HNB products, because as I say, there is no level that is safe for this HNB. So we have to raise our awareness vis-a-vis the HNB claims. Well, Chairman, my second round, we have listened to the views expressed here. Back in 2014, we also thought that e-cigarettes should be banned, even though there are successful cases where e-cigarettes could be beneficial for addiction, because there are different addictions. But anyway, e-cigarettes are chemicals. We don't know what are the components. So it is difficult to assess the impact on the body. But what worries us is that for these e-cigarettes, you can also have add-ons, and these add-ons are no guarantee. For the HNB cigarettes, since we look at it from a different point of view, well, this is also a tobacco product. However, they are very similar to conventional cigarettes. Are you only comparing the damage of these two products? Are you focusing on the choice of smokers, on the relationship between the smoker and the family, or are you looking at the future projection of the total of smokers in the community? So where is your focus? And I think that you should explain your focus. Well, there is also a problem of enforcement, whether enough is being done. Well, there is an argument that you cannot really are you going to be able to have an overall ban? Whether the ban will lead to more contrabands or less contrabands, and how you are going to hit against contrabands. Of course, illicit products will work together with the customs and excise against illicit cigarettes. Our policy target is as follows. Of course, the overall policy is to reduce the prevalence of smoking. There is proof that tobacco, apart from carcinogenic substances, we know that 60% of illnesses are non-communicable diseases or chronic diseases in our hospitals. And smoking is one of the greatest risks for such diseases. Of course, alcohol and no sports are also risk factors, but smoking is a huge factor. Even without these new products, we would still need to reduce the smoking prevalence. That is why we have a multiple-pronged approach. However, there are new products or ASPs, and they pose risks, and they are challenges to our tobacco control policy. And it runs counter to our quit smoking policy as well. They said that the ASP can help you to quit smoking, but the thing is that there could be dual uses, and very often smokers tell us that that is the case, where they will go back or go for a double use. Now, we are going for the long term. For public health approaches, if we are to protect the people's health, in the last 30 years, we have reduced the smoking prevalence rate to 10%. We don't wish to see that the new products would create a new generation of smokers. And that is not something that we would like to see for Hong Kong.
Anyone else who would like to supplement? Deputy Secretary. Well, you mentioned about resources spent on law enforcement regarding a complete ban and regulation. Well, if it is regulation, well, tobacco products will have to pay duty. Well, whether it is a complete ban or a regulation, we will continue to combat illicit cigarettes. If it is a ban, that means the product should not be allowed to come to Hong Kong. If it is regulation, then it involves imposition of duty. So there will be law enforcement action taken. We may need to use additional resources on regulation. Someone mentioned about registration regime. It is a form of regulation. Well, the content may not be stated clearly. If they are allowed to be sold, then we will have to conduct testing under the regulatory regime. These are all additional costs. A prohibition of sale to those under the age of 18 is also another cost. We have to explain to the public why it is harmful. So if it is a regulation, then we have to devote more resources on public education. Whether it is heat-not-burn cigarettes or e-cigarettes, there is evidence showing that in the long run, they are hazardous. So we prefer to spend resources on, say, for example, treatment of illnesses as well as smoking cessation. So it's difficult to just say whether there will be more resources or less resources if it is a regulation instead of a ban. Mr. Frankie Yik, speaking for the first time. I was asked by my constituents to speak to you. Well, my sector is logistics. It seems that it is irrelevant. Well, if it is transshipment, then it's not affected. But I've asked Mr. Shiu Ka-fai. Shenzhen is the biggest manufacturing base for e-cigarette or heat-not-burn cigarette devices. As a result of the ban, that there will have to be repackaging and they will have to be distributed. It is not a direct sale, it's just a distribution. With the ban, then the business cannot go on because the product is not allowed to enter Hong Kong. For this business, the amount they have taken from outside Hong Kong and the amount that leaves Hong Kong is exactly the same. Nothing enters the Hong Kong market. So for such business, will they be affected? I will defer to the Deputy Secretary. Well, it is a ban on import, distribution, manufacture, sale, and advertising. We will consider the scenario you've just stated. Perhaps let's hear from the DS. There are some exemptions, transshipment via ports or via the airport. The example cited by Mr. Yik involves a product entering Hong Kong, so that will not be allowed. Our proposal is a ban on the import, manufacture, sale, distribution, and advertisement of alternative smoking products. It's about whether there will be a loophole if the product enters Hong Kong and how we can ensure that it all leaves Hong Kong. We've heard from submissions and deputations that there may be a black market. Well, I understand, but the example I've cited does not involve manufacturing, distribution, and sale. It's just processing. It's not processing as per se, it is just repackaging and then it will leave Hong Kong. They can declare the amount. If it is not correct, then you can impose a heavy penalty to make sure that it is not worth running that risk. But now you have just killed that business. This business does not run counter to your policy objective because there won't be any product entering the Hong Kong market illicitly. Will you consider that? It doesn't matter if you can't give me an answer now. Please consider it, because this will have an impact on the logistics industry. This does not run counter to your policy intent. I asked the Secretary to have it recorded. Speaking for the second time, Mr. Kenneth Leung. I would like to follow up on illicit cigarettes. Whether it is a ban or a regulation of heat-not-burn and e-cigarettes, there will still be the problem of illicit cigarettes. So regarding law enforcement and proof, under the two regimes, namely ban and regulation, which one will be more effective? Can we hear from the Commissioner for CNE? From my experience regarding law enforcement, if the provisions are stated clearly, there's little difference between the two regarding proof. If there is a complete ban and our frontline officer spots one or any other amount, then there will be interception, and then we would refer the case to the alcohol and tobacco office. Currently, if it is regulated under the Dutiable Commodities Ordinance, say for example, under 19 cigarettes, it's legitimate, and we will just simply let them in if it is under 19. So would that be a different form of law enforcement or different way of proof regarding a ban and regulation? Well, currently it's a form of regulation. Have you encountered any difficulties in relation to enforcement? Well, if we identify passengers carrying an amount that is over and above the allowed amount, then we will take action. If it is proved that there is a breach, then we would be able to take enforcement action. In the future, if it is a ban, we will use the same standard to take law enforcement action. I don't have any question for now, but I would queue up again. Mr. Ma Fong Kwok speaking for the first time. I represent the show business. For quite some time since the emergence of heat-not-burn and e-cigarettes, for entertainment performance, if they would like to use smoke as a special effect, well, in the past, if they use actual smoke, then the whole stage will have to be covered with fireproof material. And now they can use e-cigarettes or heat-not-burn cigarettes to create the same effect. As a result of your proposal, will there be an impact, say for example, for special effect on stage? Would there be a special allowance given to them so that it can be used? I don't really understand, especially when it comes to heat-not-burn cigarettes. It is said that it is less harmful to one's health. Well, how can you, if you don't allow people to use it, if you don't allow people, if you don't allow them to circulate in the market, how can you prove that it is still harmful to health? And what about those who are trying to quit and they've turned to heat-not-burn cigarettes? That means they won't have a choice anymore, because they will have to go back to conventional cigarettes because they can't use e-cigarettes anymore. That means they will be subject to more harm. How can you address that? Mr. Ma mentions the show business. Well, if it is an individual, then we would ask them to quit. There are many different smoking cessation services available. If you think that there is room for improvement for the services we have offered, of course we would try to improve them. Currently, they are free of charge, and effective cessation methods are used. And I have been saying that people have a misunderstanding that e-cigarettes, heat-not-burn cigarettes or alternative smoking products are not as harmful. That's why they wonder why we don't ban conventional cigarettes, and they ask where they can turn to if they can't use e-cigarettes anymore. They say this under the assumption that alternative smoking products are less harmful, but from the perspective of medicine, and if you refer to studies done by the WHO or other medical research, any tobacco products, no matter in what form they are harmful to health, and there is no such thing as a safety standard, as a safe standard. So we don't want members of the public to use any kind of tobacco product. I do think that the government will have to step up on public education so that the public can be more can have a better awareness in relation to alternative smoking products. But you have not answered my other question. What about stage effects? Well, they use e-cigarettes or heat-not-burn cigarettes as props. It is allowed to smoke on stage as part of the performance, but in the future, after we have banned e-cigarettes and heat-not-burn cigarettes, we have considered that, whether there should be an exemption, because currently smoking as part of a performance is allowed. So even if it is indoors, one is allowed to smoke if it is part of a performance. In the future, if we ban the sale of heat-not-burn cigarettes and new products, by the same logic, that there can be the same exemption. Well, I don't know whether we can give them the same exemption. No, they use e-cigarettes or heat-not-burn cigarettes to simulate an act of smoking, because it looks like someone is smoking, but there is no naked flame.
Well, in the past, they need to have a foam spraying against fire for the whole scene before. So what he focused on is that, do you need to register or make records? Well, if the amendment passes, then the product is banned, and of course that would not be allowed even for performances. Well, Deputy Secretary, there is an exemption for performance on stage for smoking. We are saying all along indoor ban on smoking, and there could be an exceptional case. For instance, in a performance, they could. Now, so against this assumption, the principle is in non-smoking indoors. However, there are certain cases where that would be allowed. As for new products, we are now treating it as a new product in this new amendment, then we are not following the old conventional cigarette practice. So they can still do it now for conventional cigarettes. Well, yes, you can smoke in an old way, but not in a new way. Well, you have to note it down and come back for it. Mr. Ho Guan Yu, this morning you had not had opportunity to reply from the administration. In the long-term anti-tobacco campaign, would you have a specific time for banning of smoking? However, for those 700,000 smokers, well, in 2025, the prevalence rate will fall to 7.8%, which is about 400,000. So there should be a grandfather clause. Well, you should register as a smoker, so you can smoke either ASP or HNBs or conventional cigarettes. However, there should be a cutoff date. That means that you can show your determination for tobacco ban. For not under 18-year-old, they cannot smoke at all. Well, then you can demonstrate your determination to anti-tobacco. Well, it is similar to methadone. It will be phased out eventually. I'm against smoking, but there are people who have a better condition after HNB consumption. You are now hitting very strongly against HNBs and ASPs. However, we cannot see your determination vis-a-vis conventional cigarettes. But you are saying that the e-cigarettes may also harm health, but not as much as the conventional tobaccos. So if prevalence falls under 10%, then you will have a complete ban. Well, you are saying that if we do not have a total ban, the prevalence rate will rise because ASPs are cleaner and are not very visible. Well, this morning I have said that why is it that you have a complete ban of ASPs? I think you should take this back and have a general blueprint. In 2000 and 2006, you have a complete ban of all cigarettes unless it is licensed, registered. Well, if you have a complete ban for all products, then he would support you. I would like to thank Mr. Ho. A complete ban of the ASP is the first step and a very important step. As I said, we all understand the hazards of smoking, and the efforts we have put into anti-smoking has given us good results. The ASP is a challenge to health because they would attract the young, and non-smokers could have a misunderstanding that they are less harmful than conventional cigarettes. As I said, they are all harmful and there is no safety level. After the banning of the ASP, how can we be yet more determined for conventional cigarettes? Absolutely so. By 2025, we need to reduce it down to 7.8%. Well, we will encourage the quitting of smoking, and secondly, we hope that there will be no more new smokers. And with these two approaches, we can reduce the prevalence, and we are targeting both. Thank you. Third round, Mr. Siu Ka-fei. Mr. Wan, ask you, why is it that you are not banning conventional cigarettes? There are about 100 present here for today, but there are 300 submissions. Well, if you dare to touch the conventional cigarettes, there will be over 100,000, because it is populism, because if they are numerous, then you wouldn't dare to go against smokers. You are asked whether there will be more and more illicit cigarettes. There are about 25% smoking illicit cigarettes. That is to say, about 150 smokers now smoking illicit cigarettes. What about the future? If you want to eliminate the newspaper stands, smokers will continue smoking. I don't understand this. There are lots of contraband cigarettes everywhere. Mr. Yip Jiming asked about transshipment. Well, you said that the ISPs cannot be manufactured here. You are saying that such a ban will lead to better health. However, for instance, why do you ban the manufacturing of ASPs here only for export? We can see the sailing of contraband cigarettes. Well, if you have a manufacturer here, you can go after it more easily. Now, I'd like to ask Mr. Fong, you are talking about hazard indexes. For instance, the exhaust gas from cars, are they not carcinogenic? I don't have such statistics. I cannot reply you. Well, the secretary is here. I'd like to ask you, the exhaust from pipes of cars, are they carcinogenic? Are they not? Thank you for Mr. Shukafei's question. Talking about carcinogenic or non-carcinogenic, we are looking at the risks. In our daily life, we get in touch, we are in contact with substances. If the substance is of high risk and there is proof that they are a hazard to health, government will be responsible for it, and tobacco is one of it. Secretary, you know that the exhaust pipe gas could be carcinogenic. It depends on the amount you inhale. That is why you are proposing more cleaner fuel. Now, well, we know. Would you say that in the polluted air that we breathe in, that there are substances that are carcinogenic? It depends on the amount. Well, what sort of report are you based on? Have you asked independent reports for the NHAs, the Royal Hong Kong Medical Faculty, and also the China studies? You don't quote them at all. However, there are researchers saying that the HMBs are on a par with conventional cigarettes. Well, HMBs are only here a few years ago. How can you say that you have enough time or enough evidence to prove that that is the case. You are saying that other studies are not valid, but yours are valid. There are 3 more sessions on this topic. I would sit on and continue asking questions. Okay, there are other members queuing up to ask questions. Oh, right. You are here all day, the chairman. There was a Frenchman. He arrived here, and he couldn't understand how there was no ASPs. Well, for a tourist arriving here, well, he used to smoke HMB. The Macau allows a tourist to have it tourists to carry HMBs in. Well, you are talking about e-cigarettes. Well, that has nothing to do with HMBs. Okay, I'll be mild in my views. Don't mix everything up. I will continue 4th round. Mr. Leung Kai-cheng, Su Ka-fei has been brilliant in his arguments. I'd like to know, if you ban the HMBs and the e-cigarettes, what is the impact on the economy? Well, it has an impact on some of the livelihoods here. And the economist says that there is a certain kind of impact. I like Milton Friedman and liberal economy. However, I don't have a complete study on the economy. If you ban ASP, there will be less such activity, economic activity. However, what are the gains that we might have against such decrease in such a kind of economic activity when you ban the ASPs? Well, would productivity rise? Would the medical costs be lowered for the treatment of chronic diseases? Well, the decrease in economic activity is on one side of the equation. The other side of the equation is there a rise in productivity? Will there be a lowering of medical costs linked to chronic diseases? Well, if you cannot consume such a product in Hong Kong, would that have an impact on tourism?
Because smokers, if they're not allowed to use these products, they will go elsewhere, say, for example, on the mainland or Taiwan. Will this affect our tourism industry? So these are different considerations. I know that there isn't much research done in these areas. I think there are still some questions that the administration can't answer. For the time being, why do you not ban conventional cigarettes? Dr. Pierre Chen asked why is alcohol not banned? Well, I've done some researches. Well, alcoholic drinks came into existence in 610 BC, and for tobacco products, they had a history of 5,000. There is a place called Bhutan. I think that, well, if there is a complete ban on cigarettes, I'm afraid that even the most popular government will have to step down. I think there is political consideration why conventional cigarettes is not banned. But these are new products. They are hazardous. The government would like to ban them as far as possible for public health reasons. That itself may be a political decision. Mr. Xu said, well, there won't be any visitors coming to Hong Kong if they can't bring with them these products. Well, if they can endorse the Fugitive Offenders Ordinance, perhaps they can do this as well, right, Mr. Xu? Anything to say from the administration? I thank Mr. Leung for his views. We are the Food and Health Bureau. We have the responsibility to protect public health. Mr. Leung mentioned about chronic illnesses. From the records of the HA and fatality records and whether these fatalities are a result of chronic illnesses, I can tell you that the number is quite high and is on the increase. That's why we have devoted more resources on primary care. Smoking is a major reason causing chronic illnesses and deaths. We need to try to reduce population of smokers. Well, we understand that there will be different views, opposing ones even, with regard to control and regulation, but we have to strike a balance because the majority of the population are not smokers. We have received complaints about second-hand smoke. They would like the government to do more to cut down on second-hand smoke. Regarding smokers, of course, at the start, we would try to facilitate them by being lax. Some visitors may be smokers, but there are many smokers and many visitors who would like Hong Kong to be smoke-free. They don't want Hong Kong to be. They don't want to be subject to second-hand smoke when they come to Hong Kong. When it's my turn, we have heard different views today. People have not just told us about their personal experience, or they have also spoken about the influence of tobacco companies. There has been a number of reports saying that heat-not-burn products are not as hazardous. I think, well, they have kind of brainwashed us, but doctors said that the harm from heat-not-burn cigarettes is not lower than conventional cigarettes. We ban advertisement of conventional cigarettes because advertisements may influence one's thinking. If smoking is linked with sports, then you may mistakenly think that smoking is good for you. People are also concerned about the impact of heat-not-burn cigarettes on the number of smokers. Some people think that heat-not-burn cigarettes is better for themselves and for their families, and their people won't roll their eyes when they go out to smoke. I think the government's stance is different. If there is a prevalence of heat-not-burn cigarettes, will it bring more harm than conventional cigarettes? I think people are speaking from two different positions. We do need more discussion before we can reach a conclusion. Newspaper agents think that Well, since there is a large number of duty not paid, heat not burned cigarettes here, well, seeing that a profit can be made, perhaps they would like to get a share out of it. They don't have much faith in your effort to combat illicit cigarettes, because if you ban heat not burned cigarettes, that means the black market will boom. I think the government, the administration needs to think about it further. Well, the year before, they have seized 700,000 heat not burned cigarettes. Last year, it was 8 million of them. How do you explain the situation? How can you make the public understand? Can we hear from the Secretary? Well, it is about combating illicit products. We will continue to talk to the CNE department about how to combat illicit cigarettes and alternative smoking products. We need to look into it in depth. You mentioned about the livelihood or the business of newspaper agents. Well, the FEHD permits them to sell newspapers and a list of items under the permit. They don't necessarily want to sell cigarettes, but they would like to maybe have the list of permittable items for sale expanded. We will talk to the FEHD to try to find ways to minimize the impact. Last person, Mr. Shilkar Fai, speaking for the 4th time. Thank you. Just now, the Secretary said that most people are not smokers. I'm very worried. Well, most Hong Kong people are not homosexuals. And we've already said that we will tolerate them, will be inclusive, and that we should not do something to try to phase them out. We have freedom to choose. Otherwise, Mr. Ray Chan will not get as much support. It's not the case that the majority rules. Well, I don't remember last time there was a change, and there was a change in the health hazard covering 85% of the packaging because we have to follow the EU. Well, can you now tell me that which country nowadays ban heat not burn cigarettes? Can we hear from Dr. Fong maybe? It's in the supplementary information. Can you remember off the top of your head? It doesn't really matter. I'll tell you. About that, not more than 30. Yes, they are African countries. People, they are not very known. Last time, you said that we should follow Canada, US, and the UK. But this time round, you don't follow these big countries. Explain to me. You just cherry pick what suits you. Is that right? That is unreasonable. How can you do something like that? Sorry, I will have to be gentle because the secretary has hurt her hand. But just now we talk about the healthcare. Dr. Chan is not here. Let's hear from the secretary again. Well, and they said that most of the patients staying in hospitals are there because of cigarettes. But you at the same time tell me that 90% of Hong Kong people are not smokers. Does it mean that all smokers are all in hospital now? Do you have the figures? May I? Yes. I would like to clarify that it's not because 90% of the population is not smokers that we don't respect smokers. We have used a lot of resources to help smokers. We would like them to quit. About alternative smoking products and the ban. Back in the 1980s, there was a ban of smokeless tobacco. Because we thought, sorry, you're digressing again. Please come back to the question. Do not go off a tangent. I asked you, is the majority of patients staying at hospital smokers? Well, either you're wrong or Dr. Chan's wrong. It's not the case that I did not answer your question. You mentioned a number of things. Well, there is another topic that I have not covered, but I'll wait till the next public hearing. You mentioned about non-communicable diseases and chronic illnesses, say for example, hypertension, heart disease, or cancer. Well, they are mostly in hospital. Okay, I will ask my assistants to look at your figures. Please give me the figures. Well, you are saying that 90% of the population doesn't really spend time in hospitals because they're not ill. You have half a minute. I will leave it till the next time. Thank you. I thank deputations and individuals for coming to speak to us, and I also thank legislators and the government and the officials. This is the first of 3 parts of public hearing. Thank you. Any other business? Well then, meeting adjourned. Thank you.